Hi, my name's Viv. I'm the mother of Sophie, who is 18 months old. She had Biliary Atresia and followed up with that a liver transplant when she was just short of 7 months old.
And I'm Andrew Day. I'm a paediatric gastroenterologist working here in Christchurch.
Cool. Okay, so our first question is, what is Biliary Atresia?
So the liver sits up here on the right side, and it's connected to the body in a number of different ways in terms of blood vessels going in, blood vessels going out. There's also a tube that comes from the liver down to the bowel where the bile that's made in the liver gets transported. In biliary atresia, that tube, the common bile duct, becomes completely scarred and blocked so that the bile can't leave the liver and get to where it's meant to be in the gut. And what that leads to is progressive scarring within the liver that eventually stops the liver working, impacts upon how the liver's working. And in addition, bile's really important in terms of how we break down fats, how we get nutrients from our food. So when bile's not coming through to the gut, then that impacts upon absorbing fat, absorbing vitamins, and then upon baby's weight gains and growth.
What causes Biliary Atresia and how common is it in New Zealand?
So it's not completely clear exactly what causes it. There are some congenital forms where there's changes that happen during pregnancy or when the baby's in the womb. But in most cases it begins soon after birth. And it's probably a combination of the immature immune response in that part of the body, perhaps triggered by viral infections, because there are some studies that show seasonal changes that go along with viral infections. And there's probably some genetic components that, again, we haven't fully understood. So the exact cause isn't known, but it's a combination of those different factors. And probably somewhere around 12 infants in New Zealand are diagnosed per year. It varies a little bit from year to year. Biliary atresia is more common in some parts of the world than others. So in Taiwan and some Asian countries, for example, it's a bit more common. In New Zealand, it's more common in from the Pacific Islands and people of Maori extraction, and a bit less common in Europeans.
So what would the main course of treatment be when Sophie was diagnosed with biliary atresia?
So biliary atresia usually presents with jaundice, and it's a particular pattern of jaundice, and then along with that, the stools are pale. And the stools are pale because the bile's not getting through into the gut. So when we're seeing a baby with jaundice, with pale stools, who isn't growing very well, we have lots of concern in terms of biliary atresia, or perhaps one of the other things that can cause that pattern of bile not moving through. So there's a whole lot of tests that we do initially in that type of jaundice to work out the cause. And some of those causes of that type of jaundice are things that need immediate help. Some of them are things that get better by themselves, but we do a whole lot of tests, ultrasound, blood tests, urine tests, and a liver biopsy, all fairly promptly so that we get the answers as soon as we can. And that's a really important part of things. And that's a message over the last years that we've been trying to promote more and more to midwives and GPs in terms of responding in the scenario of a baby with jaundice and pale stools to respond and refer early because it's really important.
Cool. Which is what happened to us, isn't it?
And upon diagnosing biliary atresia and excluding the other causes, then the next step is an operation to bypass that tube that's scarred. So it's bringing a part of the bowel up to the liver so that the bile can then drain through that segment and back into where it should be, and relieving the pressure or the impact upon the liver in terms of the scarring.
Cool.
And that's called a Kasai procedure. It's a fancy name called portoenterostomy. But it was designed initially by a Japanese surgeon some decades ago called Dr. Kasai. And although it's been perfected and optimized a little bit over time, essentially it's the same procedure. But it's taking away the part that's scarred and then connecting up so that the bile can drain. And that upon diagnosing biliary atresia, that next step of getting the operation, again, is timeliness is really important. So we want to make the diagnosis and get on that next step as soon as we can.